As of the posting of this video, the last couple of days have been big GLP-1 news days on two fronts. First, Zepbound Vials have just gotten a major upgrade and a price drop, kind of, sort of, and Novo Nordisk just lost exclusivity on Ozempic in one of its biggest global markets. And someone, I'm sure, is in huge trouble as a result. In today's video, I'll walk you through exactly what's changed, what's happening, what it means for your wallet, and what to watch for next. So let's jump in. Pharmaceutical company Eli Lilly, known as Lilly, has officially made every approved dose of Zepbound, tirzepatide, which is the weight loss version of tirzepatide, available as a single dose vial through their online pharmacy called Lilly Direct. That includes the 2.5 milligram starter dose, which goes for $349 a month, and the 5, 7.5, 10, 12.5, and 15 milligram doses all will sell for $499 a month. Prescriptions for the new higher dose vials will open on July 7th, with shipments expected to start going out in early August. That means no insurance, no saving cards needed, just flat pricing. And this is especially important for a couple people. Medicare and Medicaid patients for sure who can't use savings cards, and anyone paying out of pocket for these medications. People who need the higher, more clinically effective doses and haven't been able to get their hands on the 12.5 and 15 milligram doses since they were simply not available until now, or in a month or so, are going to benefit. So let's talk about why the 15 milligram dose matters. It's because in Lilly's SURMOUNT-1 trial, the 15 milligram dose led to 21% average body weight loss. And 1 in 3 patients lost over 25% of their starting weight. That's life-changing progress, any way you look at it. And now, at a flat monthly price on top of that, so let's be real, $499 is still not affordable for a lot of people for the long term. And I know that. And here's the kicker, the pen version of Zepbound, it's still priced at $1,000 to $1,200 a month, or $450 if you can get your hands and get the savings card to work for you. So the question becomes, why charge double for a pen when the exact same medication is $499 in a vial, and you're telling me the company's saying that? So my take on this move proves Lilly can actually bring tirzepatide down to a more accessible price, and convenience of a pen isn't really worth a $500 markup. And this is a wake-up call to push for price parity across formats. If you don't want to go the compound route, this is the best and most affordable option right now. Speaking about affordable options to make a lifestyle change, here is an exclusive offer from this video sponsor. Let's take a quick second to talk about something people ask me all the time. Dr. G, do I really need to go through a dozen doctor's visits and jump through hoops just to try a GLP-1 medication and improve my chances of finally losing weight? The short answer? Nah, not if you do it right. Mochi Health is making evidence-based obesity treatment easier to access for so many patients, making them one of the best ways out there, all without sketchy compounding pharmacies, multi-level marketing vibes, or just trust me, bro, medicine. This is why I love what they are doing right now with weight loss medications and online support. They've got licensed clinicians who actually know what they're doing, and they help you navigate insurance or cash pay options with transparency. If you're ready to stop guessing and start treating your increased weight like the chronic medical condition it is, use my link below and check out Mochi Health. I'm sure you'll find the Mochi Health platform easy to use and their support helpful. So after you've watched all of my videos on GLP-1s, Mochi Health might just be the missing piece you've been looking for. Oh yeah, when you use my link, you'll get $40 off the first month. So give them a try today and get your GLP-1 meds the right way. Now, let's talk about Novo Nordisk and $1 billion mistake. And this is pretty crazy from a business standpoint, but at the same time, this will actually benefit so many people as a result. Somehow, some way, Novo just lost its semaglutide patent protection in Canada, which is the second largest Ozempic market in the world, because of just one thing. They didn't pay a $250 renewal fee. They didn't pay a renewal fee. It's kind of funny actually, and here's what happened. In 2018, Novo paid the required maintenance fee for the Canadian patent. In 2019, they missed the payment. So Canada gave them a grace period with a late fee. Pay $450 total, and we'll let you pass. But again, Novo never paid it. Now the patent is gone and can't be revived. So what happens next? Generic manufacturers like Sandoz, for instance, have already filed to launch their own version of a GLP-1 in Canada. And they're expecting approval as early as Q1 of 2026, when exclusivity officially ends. In 2024 alone, just for perspective, Canada retail pharmacies sold $2.5 billion, or Canadian dollars, worth of Ozempic. This opens the door for major price drops, possibly 50 to 80% lower for Canadian consumers. What this means for you and us here, unfortunately, this doesn't impact the US directly, and Ozempic's US patent actually runs, the US patent runs till 2032. But it does show us two important things. First, even big bad pharmaceutical companies make costly mistakes, billion-dollar mistakes. And number two, generic GLP-1s are coming. Maybe not next year in the US, but the wheels are turning. And watching what's happening in Canada, we can get a preview of what things may look like here very soon. Typically, when patents lapse, access improves and prices drop. We've seen it in the past with drugs like insulin. And I really hope we see it with GLP-1s. So, to recap, Zepbound is now more accessible with all doses in vial form going from $349 to up to $499 a month. And that includes the highest dose of 15 milligrams, and the Ozempic patent loss in Canada could be the first domino to fall in the fight for affordable GLP-1 access globally. I'll definitely keep covering these developments as they come, so hit that like button and subscribe to stay up to date with the latest in GLP-1 news tips and treatment updates for optimal lifestyle modifications and support. Until the next time, stay healthy, stay informed, and I will see you soon.